We live in challenging times. Our state is faced with many vital decisions, including areas of criminal justice and crime prevention, environment, education, employment, transportation, infrastructure maintenance and repair, growth management, and healthcare. These decisions and many more impact the state budget and our way of living. Office Anesthesia and Dentistry is a private general practice dental office offering IV sedation and general anesthesia services for patients with high anxiety levels, dental fears, developmentally disabled, gag reflex issues, or excessive decay. Without sedation or general anesthesia, many patients would not receive dental treatment. These barriers to dental care are legitimate and real. Let's review a few of our patients with these barriers. Here we have a patient with dental fear. This is a common reason for people not to seek dental care. This 2-year-old child is fearful of the dental office. But with general anesthesia, we were able to perform in a 1.5-hour appointment the following: 10 stainless steel crowns, 4 sealants, a cleaning, and a fluoride varnish. Another barrier to dental treatment is the mental status of the patient. We see a number of developmentally disabled patients. These patients are particularly challenging due to the vastness of differing disabilities. Many general practice dentists will not accept patients with developmental disabilities. This patient has never been to a dentist before, and she had 4 teeth extracted and an adult prophy. A third barrier to treatment is lack of self-esteem because of excessive decay. This teenage patient would not allow us to videotape him while he was awake, but consented to videotaping while he was asleep. As you can see, he has massive decay throughout his mouth. On this day, we performed 6 composite fillings, 2 root canals, and 3 extractions for this patient. Most often, patients with barriers are forgotten or lost in the day-to-day treatment of the general population. That does not mean we stop treating them. What are the costs of untreated decay from a financial standpoint and a social aspect? First, untreated decay continues to progress until it becomes more costly to treat. Second, untreated decay can lead to more serious illnesses and even death, which is the case with Diamante Driver of Maryland. His family had been cut from receiving Medicaid dental benefits. He developed an abscess and could not find a dentist that would see him. An infection developed, and after 2 surgeries and 6 weeks in the hospital, Diamante Driver died. The oral cavity is the portal to the entire body. Third, untreated decay is a major source of diminished quality of life. Lack of oral care can compromise the ability to bite, chew, and swallow foods, which lead to poor nutrition, cause sleep deprivation, and depression. It can limit education, marital opportunities, and distort self-image and self-esteem. Other quality of life factors include missed work days and loss of productivity at work, increased absenteeism at school due to pain, and oral and pharyngeal cancers. What if Medicaid dental benefits disappeared or were significantly reduced? Let's listen to the reactions of several parents to what they would do without Medicaid dental benefits.
I would either have to pay out of pocket or try and get him on my works, which would be close to $300 a month. And quite frankly, at the times I can't afford to pay that much, so he probably wouldn't seek dental care very often because of the cost.
They would suffer greatly because I don't have the means to pay for them because they're quite expensive. So I would either have to save up over a long term, which would put dental care on hold, making whatever is happening worse, or not get dental care at all. We wouldn't be able to afford it.
We would probably put it off until it was a painful matter and probably never in the emergency room.
We at Office Anesthesia and Dentistry believe we have a moral obligation to care for our most vulnerable citizens. A reduction in benefits will hamper this obligation. Think of our dental services as providing hope. Hope for an improvement in a patient's quality of life. Any savings from cuts to Medicaid benefits will be forfeited to higher treatment costs and associated quality of life costs, which are often overlooked. The bottom line is, can the state afford Medicaid cuts to dental care? Will you be the one to turn off Medicaid benefits to our most vulnerable citizens?